The second session will be handled by Dr. Smitha. She is the professor and head of PNNM Ayurveda Medical College, Cheruthuruthy, Kerala. So I just want to give a very brief introduction about Dr. Smitha. She obtained her bachelor's in Ayurvedic medicine and science from BPSV Ayurveda College, Kottakkal. Later, she obtained her MD from Swasthavartha from BPSV Ayurveda College, Kottakkal. She has underwent the training in clinical yoga under ICMR. She has also acted as a resource person of Sriya Kottakkal, KASE Kottakkal, School of Fundamental Research in Ayurveda, KUHS. Dr. Smitha is a member of the Board of Studies Clinical UG, Kerala University of Health Sciences. She is also an academic council member of Kerala University of Health Sciences. She has presented various papers in various national and international seminars. She has published articles in various index journals. She is also doing her part-time PhD under Kerala University of Health Sciences. She is currently working as Professor HOD in the Department of Swasthavirtha and Yoga, PNNM, PNNM Ayurveda Medical College, Cheruthuruthy, Kerala. I take this opportunity on behalf of the Department of Electronics and Communication Engineering, Nehru College of Engineering and Research Center, to welcome her. Welcome, ma'am.
Am I audible now?
Yes, ma'am, you're audible, ma'am. You can start the session now.
Okay. Thank you. Thank you all. Thank you, especially Dr. Mridula, for inviting me to this session. I hope this will be a very good opportunity for all the faculties. Actually, it's an interdisciplinary type of knowledge sharing. So I am very happy to be here. So good evening, all dear faculties. So today's our topic is actually healthcare, importance of Ayurveda in healthcare. So before going to the in-depth of Ayurveda, so let me share some findings which we are facing during the last few years. Okay, we all are familiar with the COVID-19 public emergency, which we all were in the 2020. So usually in the healthcare, public emergency or the healthcare emergency or the health emergency is mainly declared in the case of communicable diseases, that is the one which is spreading from one person to another. And this century faced the most pandemic, that is the COVID-19. So many deaths were occurred, especially in the above 60 years of age. So it was really a very hard thing for us to face because it was a new thing. So later, during these 2 or 3 months back, this mpox came, and that also the WHO was going to declare it as a global health emergency, but soon it was rectified as it was a very common organism which was found in and around. So why I am saying is that whenever the public emergency, health emergency is declared, usually all the health organizations, or especially the WHO or whatever things in the healthcare, they mainly focus on the communicable diseases, especially that which is spread through the air, which is spread through the water, like that. So all the superpowers in the world, they all in their hand, they are having the biological weapons of these organisms. We are always in contact with this organism, and it's impossible for us to destroy all these organisms. We know that smallpox, it has been eradicated from the world, but still the smallpox virus has been stored in Russia and also in London. So see, if at any time these type of organisms can be released into the atmosphere to become a biological weapon. So communicable diseases are always a threat to the humans. It is not to the humans, to all the living organisms. So let us see another emergency, health emergency, which was declared in 2011 in a Republic of Marshall Islands. Actually, it's an US affiliated Pacific island group. Usually the health studies are a little bit easier to conduct in the islands because the population will be very less and we can focus on that. The samples will, we can collect the samples a little bit easier. But here, apart from the communicable diseases, here the health emergency has been declared for a non-communicable disease. That is the surprise. So here, these all the population in this island, they were following a traditional type of lifestyle with the traditional food items and traditional occupation. But during the 1820s or 1840s and 1815s, 16s and all, so when the immigrants came to this island for so many purpose, gradually the traditional occupation and the traditional lifestyle of the people in this island changed, and they used to take more amount of processed food, and the physical inactivity came out, and they were using too much of salt food items, fried food items, all those processed things which has been imported into the island, and the traditional food which they were following has been completely vanished. So to the surprise is that here more than 60 to 70 percentage of the population in the age group, that is very important, in the age group of 16 to 25 years, they were having obesity. And from 25 to 35 years of age, all of them were, mostly 80 percentage were suffering from diabetes mellitus, and also most of them were facing an earlier death due to myocardial infarction and the stroke. So here, the government declared a public health emergency due to non-communicable diseases. So these are the two scenarios. So which can be prevented. That is the main thing. Whether it is a communicable disease or a non-communicable disease, these health emergencies can be prevented if we take a upper hand on our own health. So with this background, let us start the today's session of regarding the importance of Ayurveda in this healthcare. So Ayurveda, so especially the one which I belong to the branch of Swastha Vritta. Actually, Swastha means a healthier one. So Vritta means actually the various regimes which we have to follow in order to protect our health or promote our health, or we can prevent the diseases. So this is the area where we focus more. Ayurveda itself having two branches, that is the Swastha Vritta and the Adhurya Vritta. Adhurya Vritta that mainly focus on the treatment aspect. So, before going to the details of the various measures in Ayurveda for protecting your health, let me have some questions. So at the last of this presentation, you will be able to assess your health with this. So, have you ever assessed your health yourself? If yes, what are the parameters you used? So, in order to assess your health, while morning, getting up in the morning, how you assessed your health? So, what are the things that interfere your health? Whether you focus on your daily routine or the seasonal changes that influence your health, whether you have noticed if any seasonal change is influencing your health, or a disturbance in your daily routine. So when it is continued for 2 or 3 weeks, whether it affects your health. Have you ever observed your breath? That's very important. Whether observed your breath, about your digestion, and about your urges. That is the natural urges. That is the micturition or the defecation or the sneezing or the burping. So all these urges, whether you have observed any anomalies. So whether the mental disturbances affect your health. So these are all actually you have to look in order to maintain your health. So almost all of us have our major concern regarding our a secure job, our job satisfaction, or financial stability. Of course, we all need a financial stability and also professional achievements. So while going behind all these things, the one which we are ignoring is the health. So see, the health is supported by so many hands. Not a single hand can provide a health, and which we say a positive health. a single hand cannot provide this. So it is supported by multiple factors. So we have to look into these multiple factors in order to maintain our health. So can you tell something you are doing to protect your health? So I think we at the last we can share these things. So is it important to protect and preserve your health? So here comes our healthcare. Various healthcare systems are there in India. In almost all the countries, they have some traditional healthcare systems. They have some modern healthcare system. Then we have also Ayurveda as a healthcare system, homeopathy, yoga, Siddha, naturopathy, modern medicine. So all different healthcare systems are there in order to protect our health. So before coming to that, let me share some WHO fact sheets of April 2021. So this is actually in order to highlight the importance of non-communicable diseases, which can be prevented if we give a little bit of our day-to-day our daily routine. A little bit can be contributed to protect our health. See, non-communicable diseases kill 41 million people each year, which is equivalent to 71% of all death globally. So all these death, 85% of these death are actually premature death, which occur in the low and middle income countries. So it is not now in the low and middle income countries, even in the developed countries, it's very common. That is the premature death in the age group of 30 to 69 years, but especially when we come to the scenario in Kerala, we can clearly say that that age group is between 30 to 45 years. So it has been that window has been reduced from 30 to 69 years to 30 to 45 years. So 70 cardiovascular diseases account for most of these non-communicable diseases, especially the myocardial infarction. So followed by cancers, respiratory diseases, and diabetes. So these four groups of disease accounts for over 80% of all premature non-communicable disease death. So the non-communicable disease death, which I have mentioned in the first background regarding in that island, which has been happened, where it has been declared as a health emergency. Soon Kerala will face this scenario. So especially the non-communicable disease will declare as an health emergency soon in Kerala. So mainly tobacco use, physical inactivity, harmful use of alcohol, and unhealthy diet. These are considered to be the risk factors for the mm, um, uh, all those who are dying from a non-communicable disease. So diabetes, cardiovascular disease, stroke, cancer, chronic lung diseases. So these are said to be the main non-communicable diseases. So India's 53% of the death comes from these non-communicable diseases. And among that, cardiovascular diseases, I told you the myocardial infarction, so which mainly happens in the age group of 35 to 64 years. That was the data in the 2004. But actually, now the recent trend is the age group of 30 to 45 years. We can say that it is the highest loss in the potentially productive years of life. So we have seen so many persons who are very healthy, who are doing regular exercise, then how they are um, going to the death all of a sudden while doing practicing badminton, they are suddenly fell down, and while doing some type of exercise in the gym, they are falling down, and before reaching the hospital they are going to the death. So how we can prevent these type of death? So the lifestyle diseases in India. So while going to through the some of the states in India, if we see that in the Kerala, for the diabetes is 25.5%, pre-diabetes is 18.3%, hypertension C 47.6%, generalized obesity 45.6%, and abdominal obesity 58.9%. We will see what is the importance of this obesity in the manifestation of these diseases. So India has been declared as a growing epidemic of diabetes in India. Usually we use the term epidemic in the case of communicable diseases. But soon, as I told you, India, especially Kerala, will become a diabetic epidemic. So this is the latest National Family Health Survey, a comparison of the National Family Health Survey, phase 4 and phase 5, regarding the nutritional status of children under 5 years of age. So it's very important. See, under 5 years of age, we are having anemia, stunting, wasting, several wasted, overweight, but we are focusing that. So the anemia, which is mainly due to the nutritional deficiency, from the fourth phase of 58.6%, it has been increased to 67.1%. The same way, overweight, it has been increased from 2.1 to 3.4%. So we are facing malnutrition. So the malnutrition has two hands, either it will be undernutrition or overnutrition. So we have a population under 5 years of age facing both nutritional deficiency and overnutrition. So how we can overcome all these things? So see, it is not under the children below 5 years of age. Even in the case of men, the obesity has been increased from 18.9 to 22.9, and the case of women from 20.6 to 24 percentage. So coming to the DHS, Directorate of Health Services in Kerala, the report from the DHS, the prevalence of lifestyle diseases, diabetes and hypertension. See, so compared to the scenario of India, it's more. So here it is from 17 and 14 means here it is 27 to 25. That is the proportion of population with high blood sugar and the proportion of population with hypertension. So in the case of diabetes, it is the scenario, and in the case of hypertension also. So we are especially Kerala, we stand in the front in the case of these non-communicable diseases. So now let us see what is the importance of this obesity. So all these comes under the umbrella of metabolic syndrome. So the visceral obesity, when it happens, that is the abdominal obesity. So you all we can see that majority of the population by about 30 years of age, they will start accumulating their fat in the abdomen. So visceral obesity is a dangerous one, as because gradually it will lead to insulin resistance, leading to the diabetes mellitus, and gradually the release of free fatty acids, it affects the increase in the hypertension, and also it will interfere with the fat metabolism, leading to high triglycerides and a low HDL cholesterol. So how we diagnose this in the stage 1, which is the least ignored stage, with increased free fatty acids and increased inflammatory mediators. It is many a times in the morning time we feel like some heaviness in our body, so some type of joint pains, then we usually ignore that. Sometimes we'll be having an impaired digestive fire. So some days we feel very hungry, and sometimes we don't feel very hungry. But all these things we neglect. These are actually the starting stage of a metabolic syndrome. So we will face inflammation at various levels. That is recurrent inflammations. So these body pains. So once in once in a week, we will be facing these symptoms 2 or 3 days. So usually we say, so maybe because of the lack of sleep, I would have developed this, or maybe because of the last day's heavy schedule, I have faced this. So these are, so look into all these things. Okay. So coming to the stage 2 is dyslipidemia, diabetes mellitus, and hypertension. That is the stage 1. From the stage 1, the ignorance of those symptoms leads to the establishment of the disease. That is the dyslipidemia, diabetes mellitus, and hypertension. So this is actually a triad. So this triad works together, leading to the third stage, leading to a myocardial infarction or a stroke. It is cerebral stroke, or finally it may end in a renal disease. So in the first stage and second stage, we can easily prevent all these things if we have an observation regarding the various factors that affect our health. Okay, so this is what we usually say. That is, these are the risk factors for a non-communicable disease. That is processed food, stress, lack of sleep, smoking and alcohol, unhealthy diet, inactivity, physical inactivity, and lack of socializing. So this is a very important thing. The social health is also very important in the maintenance of the health. So because of all these risk factors, we are facing this cancer, diabetes, anxiety, thyroid disorders, obesity, polycystic ovarian syndrome, heart disease, hormonal imbalance, and hypertension. So if we look into all these factors, we can see that all these risk factors can be prevented to a certain level. So so the risk factors are mainly divided into the modifiable risk factors and non-modifiable risk factors, or the metabolic risk factors. So the modifiable risk factors, we all know: the tobacco use, physical inactivity, unhealthy diet, and harmful use of alcohol. This can be prevented 100%. So coming to the metabolic risk factors, which contribute to the 4 key metabolic change that increase the risk of non-communicable disease. It is raised blood pressure, overweight or obesity, hyperglycemia, or hyperlipidemia. So these metabolic risk factors, whenever you face these metabolic risk factors, maybe accidentally you may be facing these things. So sometimes if you go for a regular health checkup, you will be facing these things. But the other thing, overweight or obesity, you can surely observe yourself. So how we can modify these metabolic risk factors. So diet and lifestyle plays a major role in the predisposition of various these non-communicable diseases. So actually, our change in the diet pattern in the second half of the 20th century with increase in consumption of meat, especially the fried food items, increased in consumption of dairy products. Actually, it's not milk or buttermilk. We usually go for various other forms of dairy products. Increased consumption of various vegetable oils, which we use for deep frying, and also the different use of alcoholic beverages, carbonated drinks. So all these things have changed our diet in the second half of the 20th century, because all these things are nowadays, it's easily available. Apart from the seasonal change, all these things are easily available in the market. So large reductions in the physical activity have also led to the prevalence of obesity. So what is the strategy for all these things? The 2030 agenda of the sustainable development goals, they mainly focus on how we can reduce the premature death from non-communicable disease by 1/3. So it's very important. Only by 1/3 we will be able to reduce this. And how we can reduce this risk factors? That is by avoiding tobacco, excess use of tobacco, physical inactivity. It is you have to avoid physical inactivity. You have to avoid the harmful use of alcohol. So bring into your food habits a healthy one. Avoid the bad food habits, avoid wrong body postures, and avoid a disturbed biological clock. So all these things are very important for the prevention and management of non-communicable diseases. Now we will come into the scenario of these communicable diseases. So which by various forms, either it will get transmitted through air, or it will get transmitted through water, or various forms these diseases are getting a widespread form. So from the COVID-19 factors, it's very common nowadays: tuberculosis. What about hepatitis A and E? So how these can be prevented if we follow certain barriers. So by the use of mask or regular hand washing, so many techniques we are following in order to prevent these communicable diseases. Okay, so coming to the scenario, how we can prevent this communicable disease and non-communicable disease uh, from the angle of Ayurveda. So we have two branches, as I told you, that is Swastha Vritta and Adura Vritta. The Swastha Vritta mainly focus on the prevention of disease and promotion of health. That is Swasthasya Swasthya Rakshanam. So how we can promote the health, or how we can prevent the disease in a healthy person. So, and also the second one is how we can give treatment for the prevention of the diseases. So for this, we have various healthcare system from the primary healthcare level, from the grassroots level of the PHC, primary health centers, to the different hospitals and medical colleges. So in all these systems of health, in all the healthcare systems, Ayurveda, homeo, and modern medicine. So all these have both at the grassroots level and the various medical colleges at the tertiary level. So Ayurveda, which is the indigenous system of medicine, actually it's an India, a system of medicine which is developed in India from the various available herbal things in and around us. So which comes under a branch of Ayush. So WHO has been considering this as under the umbrella of the traditional medicine. So now let us see what are the things Ayurveda focus on in the prevention of health. So it mainly focus on the three pillars of health, that is or said to be the Traya Upastambha. Upastambha means pillars or the triads of health, or the three pillars of health. That is, these three pillars maintain our health. And the three important ones are Ahara, that is the food, Nidra, that is the sleep, and the third one is exercise and healthy sexual life. So how we can modify these things in our regular pattern? That is, the daily routine is very important as far as health is concerned. Now we will see these are the main parameters which we focus on. So in order to assess our health. Okay, so the first one is desire for food. So when we wake up in the morning, So think about your digestive fire, whether we have a appetite is there, whether we have a desire for food is there. And as whether we will have a desire for food when only we have a proper digestion. So whether we are having a proper defecation and maturation, whether we feel a lightness of our body, and whether our the sense organ, especially the eyes, the nose, the ears, whether the sense organs are in good condition, and whether we got a very good sleep or whether we got a very sound sleep, whether our mind is calm, and finally whether we have a proper digestive fire. Only if have a proper digestive fire, so we will get our food get digested in a proper way, that is proper digestion. So if a proper digestion is there, we will be having a proper defecation and maturation, and then only we will have a proper desire for food, and then only we will be having a lightness to our body. So when the digestion is proper, the elements will be absorbed from our body in a proper way, which maintains our health, and especially the all the cells in our body, and also the proper functioning of the sense organ also. So it is not the digestive fire. At the same time, we should have two other things, that is the sound sleep and calm mind. So these are the parameters which you can assess. So if there is anything wrong in that, you assess your own habits. So what are the things which altered this? Then you can correct yourself. So these are the various regime which we follow in Ayurveda in order to protect our health. That is the Dhinacharya. It is the various daily routine. How we can modify our daily routine. So in order to promote our health. So what are the things which we have to do as a part of this night regimen? So while the seasonal changes happens, of course there are changes that happens in our body. It's almost so many studies are there. That is whenever the seasonal change happens, so there are some physiological changes in our body. It is happening. Some physiological changes are happening. So if our body is healthy, we will be able to overcome those physiological changes without changing it into a pathological form. But if our health or if our strength is low, then automatically we will get diseases in this seasonal change. Another important thing is sadvrita, that is the code of ethics, which is mainly related to our mind. And another important factor we all ignore, the one is the vego dharana dharana. Vega means the natural urges, which I have mentioned about. We all will be focusing only on the defecation and the maturation. So both the suppression and provocation of natural urges leads to diseases. So first we will see about the dinacharya or the daily routine. So the daily routine means it mainly focuses on the various measures for the protection of the sense organs. That is the protection of our eyes, protection of our nose, protection of our tongue and ears, and also our general skin. So you all will be familiar about the various types of anjanas, or the various type of preparations which we are using in the eyes. I have seen so many persons using this netramridam, so many persons using Oftacare eye drops, so many persons using this iton eye drops. Some they will be using this Triphala churnam. Triphala, they will make a decoction of that, and they cool and filter it, and they use for the protection of their eyes. Some will be using Ilanir Kolampu, some will be using Kajayapanam Kolampu. So in various conditions, the eyes, as we all know that each individual is different from the other. That's why we usually say that that the phenotype is different. So based on that phenotype, we usually tell it as prakriti. That is the characteristic of a particular individual. So in that particular individual, in Ayurveda, we mainly focus on different type of mainly three functional units of our body. That is, the three functional units include the Vata, Pitta, and Kapha. So the Vata is the one functional unit that maintains all the movements. All the movements means our voluntary movements, involuntary movements, the nerve stimulus, the nerve impulses. So all types of movements are controlled by the functional unit Vata. So Pitta is the one which mainly focus on the digestive purpose. So it can be the all types of enzymes. So all those which go for a digestive purpose, or we can consider it as the functioning of our mitochondria and all. So the various transformations are mainly the function of pitta, and kapha is the one that build up the body, that is the as the functioning of our proteins. So the various proportions of this vata, pitta and kapha is different for different individuals. So based on that, we have to take the various medications. That is the importance. So for if all the persons cannot use the same medicine, even if they are having an itching in the eyes, they cannot use the same medicine. That is the important thing. So personalized care is very important. So all the persons cannot use triphala decoction for washing the eyes. All the persons cannot use that netramritam, that is the decoction which is prepared with the lothra pachoti, you will be knowing. So there are different type of medications for the protection of our eyes. So usually we use a different type of kajals and all. But the most important one which we prefer is one which is prepared with the puvangurundal. In so in market also it is available. But it's not essential to use this in all the seasons. But in particular seasons, we insist to use these type of anjana preparations, or these type of preparations which we have to apply the eyes. And another one is we have different type of decoctions. As I told you, triphala is the one which is prepared with the which we called karagapulle. So on different conditions, we will be using different type of medications in order to protect our eyes. The same way, use different medications to protect our nose. So those who are having recurrent rhinitis, or those who are getting recurrent sinusitis, in all those things, will be using different type of medication. Some will be using anudailam, and some will be using surasarkam. Different type of medications are there. So don't go for an OTC product, over the counter product, in order to use these things. So better to consult an Ayurvedic doctor, even as a daily routine for protection of your health. So consult a doctor, then they will refer your particular phenotype and prescribe what all the medications you have to use. And also there are certain medications like gantusham and kabalam, that is the different type. So first one, anjanam, that is the collyrium, I have already told. Then the nasal instillations, that is the nasyam, which we usually call nasyam. The another one which we use, that is in order to protect our teeth and also the tongue. So we usually keep a particular liquid in your mouth for a particular time, and just it's like a gargling only. So even if a small type of aberration that happens in your mouth, we can use these type of decoctions. And the most common one which we are using is the decoction with the triphala. Triphala churnam can be used. That is half teaspoon powder boiled with 1 glass of water. Let it cool, and we can have a mouthwash with that. Another thing is honey. So in lukewarm water, we'll be adding 1 teaspoon of honey, and you can use that as a mouthwash. Another one is the turmeric. A pinch of turmeric and a little bit of honey can also be used as a mouthwash. So there are different type of mouthwash which we can use, which can be used in different conditions. So, and also for the protection of the ears, usually as a part of the daily routine, we advise this oil massage. But we know that it's very difficult to, in the current scenario, it's very difficult for all the people to do a daily massage, a daily oil massage. So we usually advise either you can go for weekly once, or at least monthly once go for a oil massage. So it will be very good for your skin, and also it will strengthen your joints also. It will strengthen your joints, helps to remove the fluid accumulated as a part of the inflammation, the fluid accumulated in our body. So it will clear out all those things. So this oil massage, as a part of the oil massage, it's clearly mentioned to have a, it's not a pouring. You have to just smear a little bit of oil inside your ears and also under your foot. So these are very important, and also a little bit on your head. So there is a general concept is that we have to use oil on a regular basis, but it is not like that. As I told you, based on the phenotype, those who are kapha predominant, and it's not necessary to apply oil over the head on a regular basis. So whenever we have a throat pain or a running nose, so don't apply oil on your head. So there are so many conditions for applying the oil massage, even though it is mentioned on a daily basis. Okay, so another important thing is told as Udvartana, that is powder massage. All these are coming as a part of Dinacharya, but it depends upon different conditions. So this Udvartana or powder massage can be practiced, or it has to be focused on a kapha predominant patient, that is those who are obese. They have to do Udvartana at least once a week. So there are different type of daily procedures which we have to follow. But on a regular basis, what we are following is our protection of our teeth. It is tongue. We will be having a regular brushing, then regular tongue cleaning, and we will have a regular bath. So these three things we are doing regularly, but we can have a certain modifications in that, at least in a week. So to protect our sense organs. So how many of you are doing exercise on a regular basis? So if you see, because of our busy schedule, most of us are skipping the regular exercise. So we all know that exercise is important, but we realize, or we bring the exercise into a practice only after, if we get some type of diseases, we will focus on that. So it's not like that. At least 5 days a week, go for a regular exercise. So that which type of exercise which you have to follow also depends upon your phenotype. So some should have do a very strenuous exercise. So some they don't need that much of exercise. So the exercise is not very common to all the people. It is also having some variations. So after this, usually we advise after this oil massage, go for some exercise, and then you go for, after a little bit of sorry, taking rest, then go for a bath. So after the bath, then when we are going to the facing the our outside, means when we are going for our office job or anything like that, there comes the importance of the ethical codes. It is said to be the sadvrita. So how we have to behave to our other people, then how we should mingle with the other people. So it's clearly mentioned, even verbally or physically, we should not we should not do any type of harm to others. That we all know from the part of moral side, which we studied from the childhood days. But verbally also, it's very important. So these ethical codes play an important role in maintaining our mental health. That is why it's very important. So many a case, the stress related factors, the stress is an important factor which will lead to the accumulation of inflammatory mediators in our body. So the ethical codes are very important to avoid that. Okay, so this is the more common routine which we face nowadays. It is after getting up from the bed, we usually open up our laptops or any type of electronic gadgets. We are all around the electronic gadgets, and one cup of coffee. It is which is full of caffeine. So that is what our daily routine. And another important thing which we focus is the time. So based on our time, we are setting our daily routine. So sometimes if we a little bit of time is if we get up a little bit late, then we all will be in hurry. So speed, usually in the case of vehicles and all, we clearly say speed thrills but kills. But in the case of health also, it's like that. It speed kills. So do all the activities in a medium mode. That is very important. So think about your health, especially morning ablution, micturition, defecation, and bath. It's very important. Personal hygiene is very important. And apart from that personal hygiene, these urges, this defecation, micturition, so all these things should be kept in mind. And for that, for the protection of all these organs, we have this anjanam, that is a collyrium, nasyam, that is the nasal installations, gandusham, that is the mouth washes or gargling, abhyanga, that is the oil massage, udvartana, that is a powder massage, and of course vyayama. So some persons need very strenuous exercise, some will be need only yoga type of exercise. So yoga is an excellent type of, it is not, we cannot say it's an exercise, It gives importance both to our physical as well as mental part. That is the most important thing. And also it gives importance to the breath also. So the breath controlling movements also helps in calming our mind. So yoga is a very good suggestion, or it should be incorporated at least. So it's not a one which you can practice by seeing the YouTube videos and all. Actually, the preliminary yogasanas should be practiced from a trainer itself, from a yoga trainer itself. And you should have a consultation with your doctor also, because all the persons cannot do all the yogasanas. You have seen different type of sudarshana kriyas, that is the forceful exhalation and all. So but these things, it should not be done by a person who is having hypertension. So yoga, though it is safe, it itself having means it should not. It's also having some contraindications in some disease conditions. Okay, so all these dinacharya procedures are mainly focused on the protection of these sense organs. So Vyayama, as I told you, it's very important. We have different type of exercise. So aerobic exercise, some should be having, they should practice aerobic exercise. Some should be practicing weight bearing exercise, especially those in the old age group. So they, in order to protect their joints, so they will be having, it will be more useful for them, weight bearing exercise. So those in the adult age groups and those in the 20s and 30s, yoga will be, yoga is an excellent exercise. Some, those having back pains and all, floor exercise is very important, especially pelvic exercise, and some jogging, and for some joint exercise. So for all the persons, it's not a common way to practice all type of exercises. Okay, so coming to the other thing, that is Vego Dhirana Dharanam, as I told you, the suppression or provocation of natural urges. So we have different, we have especially two categories of these urges. One, the one which we should not means we should not suppress, and the other things which we should suppress. So we all know that we should not suppress defecation, maturation, hunger, thirst, sleep, and tear. So there are so many studies regarding this. That is, we all know that sleep deprivation, or if we suppress the sleep, automatically it will disturb the biological clock. And if it is on a long time, it almost lead to, it will affect the heart. And there are certain studies, that is a suppression of the tear, it also have some role in the manifestation of cardiovascular diseases. Another important thing is suppression of maturation, which we usually mainly see in the girls, especially in the adolescent age group. So when they go to the school, they will suppress their maturation, as the toilets are not at all neat and all. So if long time suppression of this maturation is the main cause of dysmenorrhea. So it's, there are so many studies. It is the primary dysmenorrhea. The main reason for this primary dysmenorrhea was found to be the suppression of this maturation for a long time. So for morning, from while they're coming from the home, they will have go to the bathrooms, and only by evening they will have that maturation reflex. So all these things, it's very important. So there are certain urges which we should not suppress, and there are certain vegas or certain urges which we have to suppress. That is a psychological stress. So we should not show all these psychological stress factors directly to the others. Greed, envy, aversion, competitive mentality, we all have all these type of emotional factors. So emotion should be there, but it should be released in a controlled way. So sudden outbreak of these emotional things, or it will lead to later a stressful factor in our own life. So these psychological factors or these emotions, it should be expelled out only in a controlled way. Okay, so these are all important as far as dinacharya is concerned. So coming to the another important thing, that is the food. So it's very important what type of food we are taking, what is the quality of the food, what is the, how much quantity we have to take, and there are certain rules of food intake and patya and apatya. So it's very, in Ayurveda it's very common of the term patya and apatya. So whenever people will come, they will ask, so patya, if it, patya is there, then we are not taking the medications. But patya and apatya means it is not related to what we should not take. So it comes under what are the things. if your health is disturbed at some level, what are the things you have to take in your food? So in the first part we have studied, that is the prevention, for the prevention of non-communicable diseases, healthy diet is a most important factor. So to which food we consider as healthy, that is an important thing. Whether we have to take 3 times a day a healthy diet, or only we can skip the dinner, or we can skip the breakfast, only we have to take the lunch. It's not like that. It mainly depends upon the appetite. So when our appetite is there, and when we have a desire for food, that means our digestive fire is working in a normal way. That is, our metabolism is working in a normal way. We have seen two conditions where the metabolism is very high. When we see in the case of hyperthyroidism and all, very high metabolism. So whatever food we are taking, it will be get digested soon. And another thing is metabolism, it's very low. That is, we don't feel to eat anything. Even the rice gruel, we don't feel to eat. So that disturbances in metabolism can be, it's very clear, it's very evident. So how this metabolism can be corrected, or how we can keep the metabolism in a balanced way by a intake of healthy food, that is the most important thing. So this is the general patyahara which is mentioned in Ayurveda. Actually, it's not, I'm not telling in detail, because this is nothing, it's only a um, healthy diet, healthy balanced diet. We all know that a balanced diet should contain minimum amount of carbohydrates, proteins, fats, and also it contains vitamins and minerals. So this is actually the patyahara, which includes all these things. So see, some have a notion that in Ayurveda non-veg is not mentioned. No, it's not like that. Different types of fish and different types of meat has been mentioned, but it is specified in which conditions we have to take which type of food items. So whatever food we are taking, so it should be a balanced one. It should contain enough amount of carbohydrates, enough amount of proteins, and enough amount of fats. So our staple food, we usually go for rice. So we can have a rice items, but together with the rice items, don't go for sugar. Together with the rice items, don't go for a fruit. Usually fruit is advised to take in between the meals. In between the meals means not while taking, that is half part of the meal, then one fruit, then half part of it, is not like that. So if morning, if you are taking the breakfast by 9 o'clock, and if you are taking the lunch at 1 o'clock, the fruit can be taken in between 11 o'clock. Usually the fruit is mentioned between the meals, or before the main food intake, we have to take the fruit. So whatever fruit, which fruit we have to take means it is actually seasonally available fruit, which is very preferable in and around our geographical area. Which seasonal fruit is available, we can go for that seasonal fruit. So it's better to have the fruit as such instead of going for a juice, because fiber contents are very important. Okay, then proteins. It's very important to have a minimum amount of protein in our diet, and also a minimum amount of vegetables. We should have both cooked vegetables and raw vegetables. Usually, I have heard so many persons that is during night I will not go for a food. I eat some raw salads only. Usually, raw salads are strictly contraindicated at night, because I will tell you, we have, while going to the Nishacharya, that is the night regimen. So we have to take the food in the first part of the night. That is usually around the time between 6:30 to 7:30. You have to take the night meal, and that also should be easy to digest. Easy to digest. It's very clear, easy to digest, and half the amount. So can you tell me whether the vegetables, the raw vegetables, whether they are easy to digest? They are high. They contain high fiber. So whether a high fiber diet is easy to digest? No, it's not like that. So we have to take a high fiber content diet only during the lunch. During the lunch. So all the cooked food items are to be advised at the night. So these are all regarding the patyahara. So here we usually say about two important things as rasayana. One is kshira, that is milk, but we are not getting a very good type of milk which can be advised on a regular basis. But still, though we are telling it to take in a regular basis, we know that the protein content will not digest after some after the childhood, the protein content in the milk will not get digested. So it can be taken only as a calcium supplement. But for some persons, as I said to you, those who are hobbies or those who functional elements are predominant in kapha, it's not advisable to take kshira. Another important thing which have to be taken is water. So enough amount of water, adequate amount of water should be taken. Another important thing which has to be mentioned as rasayana is krutha, that is ghee. How it is not the processed ghee, but the ghee which can be taken on a regular basis. We all know that all our cells are made up of a lipid. So for the protection of that lipid also, a minimum amount of ghee is needed. Okay. So modifications of diet and lifestyle can prevent coronary artery diseases, stroke, diabetes, colon cancer, and even smoking related cancers. And we all know that. So that is in the case of non-communicable diseases. Even in the case of communicable diseases, that is lack of proper nutrition will lead to an increased susceptibility to infectious diseases, that is communicable diseases. So whether it is non-communicable or communicable disease, we have to follow a healthy, balanced diet. It's very important. So coming to the Sadvrita, I have already told you ethical codes of conduct, that is physically, mentally, and verbally. You have to follow a ethical code. So that is very important to maintain our mental health, especially social health also. So coming, this is very important factor, that is the activation of the stress system, that is the Trayopastamba, Aharam, Nidra. I have told you the exercise and the healthy sexual life. So how mind is related to this, how stress is related to the inflammation. So this is very important. That is manasika bhavas. We usually go for an example like that. If you pour hot ghee into a vessel, the vessel will get hot. The same way, into a hot vessel, we are pouring the ghee will get hot. So the same way, the physical and mental factors are very much related. So when one is disturbed, the other is automatically get disturbed. So the activation of the stress system from the hypothalamus through the nerve impulses, spinal cord. So from the adrenal gland, catecholamines are released into the blood vessels, and see these catecholamines, they mainly focus on the heart, then liver, the digestive system, the the blood vessels, the renal circulations, and also the bronchioles. So which organ is, so for all the persons, one organ will be a little bit weak. So it will mainly target on that organ, and the particular disease will get developed. So we have to reduce our stress, and the stress can be reduced by following a proper ethical code of conduct and by following a proper stress relaxation techniques, that is especially mentioned in yoga. So coming to the next part, that is the Rutucharya or the seasonal regimen. So what are the changes that happens in the environment? So whether the changes happening in the environment can bring about changes in the body. So we know that the digestive fire get disturbed, our appetite get disturbed, and the status of our functional units, that is the Vata, Pitta, and Kapha, it gets disturbed. So the best example which you can observe is that by usually in the summer, when there is extreme hot, we don't feel like eating too much. We feel like drinking too much of cold water, is it? So the same way, when the after the summer ends and when the monsoon starts, there will be a change in the digestive fire. In the first 2 weeks, our digestive system will get an upset. So we usually tell an example that to a hot pot, if you pour a little amount of water, usually it get break. That pot gets break. Earthen pot, to a hot earthen pot, if we are pouring some cold water, then it gets breakdown. The same way, our body strength will be disturbed in the seasonal transition period from summer to the monsoon period or the rainy season. So you have to look into your digestive fire. So sometimes we feel very hungry and sometimes we don't feel any appetite, but that means your digestive fire is disturbed. So go for a very light food that can be digested in a easier way. So there are different methods of overcoming all these things. Another important thing is this winter season, and after this winter season, when that summer gradually starts, so many of the persons will be feeling too much of sinusitis and all. So especially in this period, we go for different type of nasal installations, and we go for different emetic procedures. like vomiting. So we go for some procedures. Usually all will be familiar with of purgation, but nobody will be familiar about the various techniques for this vomiting. That is the emetics we will be giving. So that also will help to reduce the kapha predominant thing in the upper part. Usually we say the organs above the neck. So that sinusitis all can be prevented in this way. So during the seasonal changes, we go for either some type of emetic drugs, or we go for some type of purgation drugs, or we go for a different type of changes in our food habits. So all these things should be done under the consultation of an Ayurvedic doctor itself, because all cannot do a purgation with Triphala Churna, all cannot do a purgation with Avibhatti Churna, all cannot do a purgation with Eranda Thailam and all. So this food and activity should be modified according to the season. So usually in Kerala, or especially in India, we mainly focus on the Indian meteorological department mainly focus on 4 seasons. That is the monsoon, post-monsoon, winter, and the summer. In Kerala, we have having 2 types of monsoon: the southwest monsoon and the northeast monsoon. So our seasonal changes are also a little bit different. So these are all. So when the seasonal change occurs, we have to modify our food and activities. So there are various detoxification and rejuvenation methods followed in Ayurveda in order to protect and preserve the health. So coming to the healthy sexual life, it's very important, and it's clearly mentioned in almost all the, I think whenever that promotion of health is maintained, this is, it has to be mentioned. It is the sexual activities, the sexual intimacy, and which are mainly a source of emotional and social support. So sexual activity means it's not all regarding the whole sexual activities. Even a hug can be a sexual intimacy, so which helps as a source of emotional and social support. So there are various types of studies showing the emotional and physical factors, relieving factors, by following a healthy sexual life. So coming to the night regimen. So as I already told you, there are certain things which we have to follow. Nowadays, we are all having a late night of sleep. Only by 11:30 or 12 o'clock, we will be going to the bed. Or sometimes some persons will have to wake up at 5 o'clock or 6 o'clock. So others, usually they will work up to 2 o'clock. Mm. Then they will sleep, and then they will get up by 11 o'clock. Usually, we all know that we used to follow a 3 to 1 as 3 hours before food. Then 2 hours we have to stop all our work, and 1 hour before we have to keep all our electronic gadgets away from us. But we are all not following that. But at least we should train our children, because they are going to be the next part of our society. So it should not get, that is because their productive life is very important. So we have to focus at least to our children. So only if we follow that, we will be able to bring out our children in that pathway. That so food intake during night, it's very important. So change your food whenever you are taking by about 9 o'clock, 10 o'clock. Change your food before 8. So make it a lighter one. Don't go for a fried food items, and reduce your quantity. Reduce the quantity. I'm not telling completely reduce the quantity. It is not like that. It's clearly mentioned that is those food items which are difficult to digest. It should not be taken at night. Then it should be light. It should be easier to digest, but it contains all the balanced all the ingredients of a balanced diet. Then only you will get a better sleep at night. Okay. So nidra, or the sleep, it's a physiological state of rest for the body, mind, sense organs, and the motor organs. It's very essential for the restoration of all the cells for cell regeneration, and also for the proper functioning of the immune system. So I think we all were mainly focused regarding all those things when the COVID-19 happened. We know that it's impossible to prevent the entry of an organism in our body. So the better thing which we have to follow is to improve our health. So how we can improve our health? We can improve our health only through a balanced diet, and only through a proper sleep, only through a proper physical activity. So sleep is very important as far as health is concerned. At least 6 to 7 hours of sleep is needed for a person. So insufficient sleep is linked to the development of a number of chronic diseases. There are so many studies regarding that: type 2 diabetes, cardiovascular diseases, obesity, and depression. So sleep deprivation, see, it aggravates the inflammation and related to the stress. So see, it's a vicious cycle. Lack of sleep, we feel like tiredness, difficulty to coping with the daily life. Again, we have a low self-esteem, feeling of worry or stress. Again, lack of sleep. So it's a vicious cycle. So go for a very good sleep. That's very important. So finally, we have reached the end of the presentation. So I have mentioned so many things regarding the where you can contribute a lot to protect your health. So assess your health through these factors. That is, whether you have a desire for food, proper digestion, proper defecation and maturation, whether you have a lightness to your body, whether your sense organs are functioning properly, whether you are getting a very sound sleep and calm mind, and that is the most important thing is our proper digestive fire. So assess your health based on these factors, modify your daily routine, seasonal changes, your sleep and sexual life. And also very important is the which type of vyayama you have to follow. So all these things are very important for a healthier and happier in you. Okay, so use the above parameters to assess your health. Observe how the daily routine and seasonal change influence your health and plan accordingly. So this is a very important thing, that is nityam hidahara vihara sevi. So always have a hidam. What is the one which is hidahara means the which is not the one which we desire, the one which is beneficial to us, that is hidahara. We have to follow that hidahara and viharas. Whatever food we have taken, whatever activity, it should be good for you. It should not be which brings happiness to you. Of course, it should bring happiness to you, but at the same time, it should be good for your health. Samikshakari Visheshwasaktaha. Don't indulge too much in external affairs. Dada Sabaha Satya Parahakshamavan. So these are all some important mental features which we have to follow. It is we should have a proper amount of emotional balance. It is some patience should be there. So all these things, aptopasevi bhavatyarogaha. So if you follow all these things, you will not get any type of diseases. So these are all regarding some important elements which we focus on Ayurveda for the prevention of diseases as well as for the promotion of health. So thank you all. Thank you once again for inviting me to this session. Thank you.
Thank you so much, ma'am. Ma'am, can we have a query session, ma'am?
Oh, yeah, sure.
Yes. Participants, you can raise your queries if you have any.
Hello, ma'am. Ma'am, please throw some light on if the body becomes acidic, then what type of food is recommended to prevent this acidic condition of the body?
You mean acidic conditions mean some type of acid rash or burning sensation, that's just like that?
Yeah.
Okay. So if you, whenever you feel like that, you just go for the food items which you are following. Usually you'll be following a very spicy food items.
Yeah, it happens.
Yeah, so you have to reduce that. That is the main important thing. We usually tell that chilies, especially the red chilies and our that tamarind. These two things are mainly focusing on the increase in the acidity of our body. So go for the food items which are cooling to our body. Especially you can go for vegetables that is like cucumber or the ash gourd or these type of vegetables should be included more in your food. Okay. Bottle gourd, then ash gourd, then cucumber. So all these things should be included.
Okay. Thank you, madam.
Okay.
Pranam, ma'am.
Yeah. Namaste.
Can you hear me, ma'am?
Yeah.
Ma'am, actually, is there any relationship between the food which you're taking and the characteristics of a person?
Yeah, sure. So if you take a very hot, spicy and food items, of course you will be in the evening. If something happens, you feel very angry to that. That is, as I told you, usually we tell that the phenotype, as I mentioned you, the functional units of the body, and the mental factors. So there is some influence in that mental factors. So if you are regularly taking too much of spicy food, automatically our functional unit, that is pitta, that will be, it will be more aggravated. So that means that mental thing, which mainly we focus, we tell that rajo guna bhava of the mind, that will be more if pitta is aggravated.
Okay, ma'am. Ma'am, actually, uh, people are classified as vegetarian and non-vegetarian.
Uh,
Okay, which is most preferred?
so it's not like that. Okay? It can be vegetarian or non-vegetarian, but the amount of food which we are taking, depending upon our digestive fire, that is very important. So we get plant proteins from both plant sources and animal sources. But the judicious use of that product is very important. So you can take a meat, cook the meat with only a little bit of spices. You can make a meat which is cooked, but it will not be more tasty. So what we do, we go for a deep frying with too much of spices. Then the whole character of that meat get disturbed.
Okay, ma'am. Ayurveda recommends vegetarian or non-vegetarian?
Both, both,
Both.
both.
Okay,
We
ma'am.
have it
Ma'am.
after explaining all these things.
Okay, ma'am. Ma'am, my simple question is: egg is a vegetarian food or a non-vegetarian food, ma'am?
We cannot say that whether it is vegetarian or non-vegetarian, but
Okay, ma'am.
regular use of egg, it's not good. Regular use, it's not good. I have seen so many persons who are taking regularly this egg on a, because as they give very much good protein, so 2 or 3 or 4 eggs regularly taking, but it's not good. Automatically after 1 or 2 months it will increase your pitta.
Okay.
Even in the case of seeds, nowadays we have a habit of practicing a oats meal in the morning as a breakfast. In that they will put so many type of seeds, chia seeds and all. So in that flax seeds, so flax seeds or the lean seeds, actually they are very too much of ushna, that is pitta predominant. So if you take 2 or 3 teaspoons of flax seed regularly, then automatically your pitta will increase.
Okay, ma'am. Okay,
So
ma'am.
even if it is vegetarian, or you can get those things.
Okay, okay, okay. It is advisable to be get away from that. I think so.
Yeah.
Okay, ma'am. Okay, thank you very much, ma'am. Thank you.
Thank you.
Ma'am, one question from my side.
Sure.
Ma'am, like you were talking about this sinusitis issue during winter season. So, like allopathy is telling us, like you can go for steam bath so that it will give you some better results. Ma'am, is there any evidence in Ayurveda which is telling us that steam bath is really helpful for this sinus issues?
Steam bath is very good for, it's clearly mentioned in our procedure. It's mentioned as swedana. Swedana is this type of steam bath and all, but it can be a generalized one or localized one also you can take. Usually in winter season you will not get that much of sinusitis. When that seasonal transition happens from the winter, when it goes to the summer,
Yes.
at that time the sinusitis will get. So during that time, if you go for a steam inhalation and all, it's very good. It's yeah, it's clear evidence is there, and we are practicing also.
So, is it advisable to use some materials like spices or something inside the hot water
Yeah, you can
and
use
then go for
tulsi leaves. Usually we advise for tulsi leaves and garlic, crushed garlic
garlic?
and tulsi leaves.
Okay, so we have to just immerse it in hot water and then we can go for the steam.
Yeah.
Is it? Okay. One more question, ma'am. You were talking about electronic gadgets now. It has become inseparable nowadays. So, like,
Yeah,
what is happening is probably till 11 o'clock we are looking into our mobile phones and then sleeping. And again, morning once we get up, we immediately look into our mobile phones. So, like, what is happening is most of us we have forgotten and we are not experiencing something called as sound sleep. We don't go into that deep sleep factor at all. So, ma'am, is Ayurveda suggesting some medicines or like something like you can add turmeric in your milk and you can have a glass full of milk so that you will have a very good sleep? Is it actually true, ma'am? Is something like that helpful for us in Ayurveda?
Yeah, there
so
are
that
there
we
are
get
so
a very good count.
yeah, there are so many things which we by modifications in our food itself, in order to get a good sleep. So one thing you have told, that is the cup of milk with a little bit of turmeric you can have. But what I am telling is, those who are having a habit of getting sinusitis, if they take milk at regular intervals at night, then it will be more disturbing to them.
Okay.
So we cannot say a common one to all the persons. Person
Okay.
and person, it will be different.
Okay, ma'am. Any other queries, participants?
Excuse me, ma'am.
Yeah. Yeah.
What type of exercises are recommended for a person above 50?
Above 50, that's very it's very good question, because above 50 we have to focus on our knees. If we are having any problem with our knees, you have to go for both weight bearing exercise as well as yoga
What
and
about
floor
ma'am?
exercise. Jogging you can go, but not a heavy type of jogging, but a minimum amount of jogging will be good, half an hour.
Okay, okay,
Along with that, floor exercise, that is joint exercises, are very important after 50.
okay. What about gym?
Gym, you have to go a little bit careful.
Yeah, because that can be risky also.
Yeah, risky also.
Yeah. Okay, okay. Thank you, ma'am.
Thank-
Ma'am, can we wind up the session, ma'am?
Yeah, sure.
Okay, so like,
Okay.
thank you for your informative presentation, ma'am. We were able to acquire a very clear insight and understanding about human health. The concepts related to obesity and diagnosis, it really provided us an opportunity to understand the status of our health and body. And also, ma'am, you were mentioning about the risk factor related concepts. So like, I felt it offered an opportunity to understand our lifestyle. Overall, ma'am, your presentation on prevention and management was extremely useful in evaluating our lifestyle. So we were able to get a very clear picture about the concepts of Ayurveda. So on behalf of the ATAL team and the Department of PC of NCRC, I would like to sincerely thank you for accepting our invitation, ma'am, and thank you so much for your informative presentation, ma'am. Thanks a lot.
Thank you all for your interactive sessions also. Thank you, especially Dr. Mridula and all under the ATAL team. Thank you all for giving me this opportunity. Thank you and good night.
Thank you, Dr. Smitha, for accepting my invitation on taking this session. It was a very valuable one. Thank you, one and all, for today's participation for these sessions. See you all on tomorrow's session at 6 p.m.
Thank you, ma'am. Participants, the feedback form and the attendance form will be posted in the group at around 9:10. So you are requested to fill it up and you are requested to submit it. So thank you all. Good night. See you tomorrow.